5 years ago, on Christmas Day, my grandma was rushed into the hospital. By the time I got to her side, she already couldn't really keep her eyes open, and it was very difficult for her to breathe. But somehow she mustered something to me. She said something to me that I've been thinking about ever since. And she said something to me that's the main reason I'm standing in front of you today. She said, "Bring me home. I don't belong here." That was one of the last conversations that I had with my grandma. Unfortunately, we weren't able to bring her home. Why is it that for 70, 80, 90 years, we live so independently, so freely? And then for some reason, in our most vulnerable moments, in our most weakest state, we are in this foreign environment, surrounded by strangers, and hoping that we can go back home. That really bothered me for some time, and I decided to do some research. And I want to share with you what I found out. The hospital might not be the best place for our aging parents and grandparents. These are the 6 activities of daily living, activities that allow us to live independently. And as you can see here, 50% of 85-year-olds leave the hospital unable to perform one of these core 6 functions that prior to them being hospitalized, they were able to perform independently. And so why is that? If you look on the bottom left, you can see one of the biggest impacts to mobility. Typically in a hospital, especially if you're frail, you'll be bedbound, strapped. You want to limit the potential of a fall. The unintended consequence is, for days, for weeks, even for months, you're stuck in bed. And of course, at that age, it makes it very hard for them to regain mobility. And as we all know, our physical health and mental health are inextricably linked. And so the impact to our aging parents and grandparents is pretty immense. So now, if not the hospital, then where should we take care of our aging parents? That's when I stumbled across this concept of home care. This is Mount Sinai's home care program in blue. And in green is their regular hospital program. And what you can see is a 50% reduction in readmission rates and emergency visits, and as well as a 50% improvement in the patient outcome. And it's not just Mount Sinai. This is Johns Hopkins with a very similar program called Hospital at Home. Similar results, 30% lower length of stay, 30% cost savings, better clinical outcomes. And it wasn't just in the US. This was happening in Europe. This is the Netherlands, where up to 50% of hospital care could be done at home. And if you can see in the chart, primarily diagnostics, as well as a lot of nursing procedures could be done in the comfort of the home. As an example, we can take chemotherapy. The average chemotherapy session lasts several hours, and one of the main reasons is the long wait times in between. You see, there's a dependency on the blood test. Patients have to be fit enough before they can be administered the chemotherapy. Now imagine if we can do all of this at home without the patient ever having to leave their own home. A nurse can go up to their home to conduct a blood test, bring it back to the lab, and when they are deemed fit enough for this chemotherapy, then the nurse can then administer the medication at home. It seems like a much better patient experience. And so these are examples from the US and Europe. But what about Asia? What about here in Hong Kong? And that's when I stumbled across this report from the Hospital Authority and Chinese University, where they analyzed hundreds and thousands of hospital admissions, and they found out that 41% of unplanned readmissions were avoidable, especially with appropriate discharge planning and home care support. And so armed with all of this data points, as well as the recent memory from my experience with my grandma, I decided to dive straight into this industry. I decided I wanted to build a home care ecosystem. And that's exactly what we're doing at Evercare. At Evercare, we come to work every day to build the future of home care, providing home medical, home diagnostics, and home therapy. We are Hong Kong's largest caregiving platform with over 10,000 registered healthcare professionals. And as you know, caregiving is not just an online experience. It really depends on high level of human touch. That's why we say that we are a human services company at our core, but with a strong tech backbone. So let me give you some context into some of our clients so you have a better understanding of this home care industry. Let me introduce you to capable Cara. Cara, like most of us, is a working professional. She's taking care of 2 teenagers, but she's also the eldest daughter. And so she has this responsibility to take care of her aging dad. The problem is, every time she goes to visit him, his condition deteriorates a little bit more. Now, because she's so busy at work and she's trying to balance already the demands of taking care of her kids, she wants to find the best care for her dad. And that's why for her, caregiver quality is of the most importance. And so Cara is a very typical example of a home care client. On average, the patient is between 70 to 90 years old, typically suffering from one or more chronic conditions: cancer, stroke, dementia, a recent fall, or maybe post-hospital surgery. And they're typically hospitalized already several times in the last 12 months. The daughter is typically the family caregiver. She's the one who's contacting us. I was a little bit surprised when I saw this. I was hoping the men would step up a bit, but unfortunately, this is the data. 70% is the daughter or the granddaughter taking care as the primary caregiver for her family. So of course, we depend on our caregivers to provide the care. So let me introduce to you some of our caregivers. Let me introduce you to experienced Elise. Elise is also a mother of 2, and she's also a grandmother. She's got decades of experience working in the hospital, both the private and public setting. But now in this new stage in her life, she wants a bit more balance, a bit more flexibility. She wants to continue to contribute because she's still fit enough to help. But at the same time, she wants to balance that with her babysitting duties for her granddaughter. And so Elise joined our platform to find flexible work. This is actually very, very common in the healthcare industry. The concept of a gig economy is very much alive in nursing care. And so for Elise, the most important thing is to find her sufficient jobs, a variety of jobs, and also just pay her on time. These are the most important things for Elise. And so Elise represents a very typical profile of our older caregivers. But as you can see here, the age mix is very diverse, from the 20s all the way to the 60s and above. 60% of them live in New Territories, 30% in Kowloon, 10% on Hong Kong Island. And we've been able to attract over 10,000 of them, primarily because of 2 main reasons. The first is we've just been lucky to be in this industry where the gig economy has been really playing out in the last 5 years. Caregivers nowadays don't want to work full-time in the hospital. They want part-time work. So that's one of the main reasons. And the second big reason is because of our app. We launched our app last year, and it's a much better user experience, which I'll share with you in a bit. And so as a recap, Kara, like all of us, we want the best care for our parents, especially during a chronic condition or post-surgery, and we want a speedy response. And for Elise, just find her sufficient jobs so that she has the flexibility to pick the jobs that fit her skill set. And that's exactly how we built our technology, to meet the needs of these two users. So Evercare is powered by a caregiving super app, where clients book caregivers who are then matched algorithmically. We are a top medical app here in Hong Kong. We launched about a year ago, 15,000 downloads, 5,000 MAUs. And probably the biggest challenge for us is how we can filter thousands of applications to find the best outcome for our parents. And if you think about it, Uber, Lyft, Deliveroo, actually their matching algorithm is somewhat more simple. They just have to find somebody primarily where the proximity is close enough and the rating isn't too bad. But to find a caregiver for our parents, it's much more multifaceted. What language do they speak? Do they have experience working with a stroke patient? What kind of skill sets do they have? How consistently can they come to my home? I don't want to change caregivers every 2 days, especially for a dementia patient. So you can imagine how complicated this can be. Because of our matching algorithm, we've been able to reduce the time to confirmation significantly. In our industry, it typically takes days or even weeks to confirm a caregiver. With us, we can do that immediately because of our algorithm. We also know a lot about our users. We know what time they're using our app. We know when's the best time to engage with them. And as a result, we know when to communicate with them where we have the highest chance of success. Once a caregiver is confirmed, we use geofencing to ensure quality monitoring so that when we're all busy at work or attending this conference, we know exactly when the caregiver has clocked in to work. And most importantly, our caregivers are trained to input abnormalities, especially in a timely fashion. Think about it. Our caregivers spend more time at home with our loved ones sometimes than we do. They have access to a lot of information, and so we have to make sure that the abnormalities are tracked in order for us to fulfill our main goal, which is how can we keep our aging parents away from the hospital and back home where they belong. And so, Evercare, we're building the future of home care. If there's one thing I hope everyone can take away from today, it's that the truth is we're all going to be family caregivers at some point, whether it's for our parents, for our grandparents, for a relative. And I hope that when that point happens, you remember that there are alternative solutions for our parents, for our grandparents, where we can keep them in the place that they're most comfortable. And you can rest assured that our team at Evercare will be working hard to ensure that we can enable quality of life so that all of you feel supported in your own and in our own caregiving journey. Thank you very much.